Welcome back to the show. Well, June is Seniors Month, and one thing we're seeing more and more is that more seniors want to stay in their home for longer periods of time. There's a great need out there as well in the healthcare industry to make this happen. And we are joined by Joan and Raphael from Bayshore Home Health to talk about this is an important subject because I think we're hearing from seniors more and more that they do want to stay at home, but they're not necessarily talking to their families and doing the important things that they need to do to make sure they can stay at home. Is that what you're seeing in your experience as well?
Yes, we are. We're finding that seniors feel that they're independent and they can live long in their homes.
Joan, what are some of the concerns that kids or parents should have about them staying in their homes too long?
Well, there are always risks. Adult children feel that often their parents might have a fall. Mm-hmm. They might have issues with taking their medications on time or daily, picking up groceries, doing personal care needs. Mm-hmm. So those are some concerns that a lot of our adult children are bringing to our attention.
Well, when TL and I were researching on the subject, we found that statistically, obviously, a lot of seniors do want to stay at home, and they're not admitting that they need any help. Now, why do you think it is that they're not admitting to their family or friends or even a health professional that they actually need help in the home?
Well, they have pride, and they're very independent. They're also afraid to go into retirement facilities or long-term care homes. So they're often denials as to the needs that they have in their homes.
Okay. Well, you've highlighted a couple of things that are, the falls, medication, these are certainly all things that we all think about. Can we talk a little bit about solutions to these problems and what family members can do and our parents can do to help alleviate the problem?
Certainly. A lot of times we try to do home modifications. So our nurse manager would go out and make an assessment for personal needs or risks in the home. So, for example, a bathroom might only need a grab bar, proper lighting, or removing area carpets, throw rugs, or even installing handles like doorknobs that can easily be opened so that seniors can stay a longer time in their home.
And you're talking about really small things that can make such a huge difference. Mm-hmm. Let's talk about Bayshore Home Health. What sort of programs and services do you offer seniors?
We do have a wide range of services that goes from nursing care, personal support. We have home support. We provide respite and companion. For example, even if adult children want to go for a wedding out of town, we can have somebody go in and look after their loved ones or their elderly parents.
Joan, you mentioned earlier talking about pride as one of the main reasons that they don't ask for help. Mm-hmm. If a family member notices that they need help, or even a friend, how should they approach that conversation?
We recommend that we be open, involve other family members, have a face-to-face meeting, have a meeting where there won't be any interruptions. You can speak freely about that. Often it's really a good idea for the adult children to come with options and recommendations. Mm-hmm. So they're prepared and they're able to give that recommendation and support.
You mentioned adult children coming with recommendations, and you highlighted a few yourself, things that we could do, just in terms of cleaning up the bathroom and putting some handles. What about downsizing in general? Say moving from, maybe it's possible for our parents to still live on their own, but maybe have a smaller place,
Correct.
A condominium,
Correct.
Home care, be it domestic home care or medical. Is that another
Correct.
solution?
A bungalow, avoiding stairs, as you're right. You're correct. Having somebody come into their home to help out is all, they're all good solutions mm-hmm. to long-term or long stays in their home.
If a family could only afford one solution, because all of these things cost money, obviously, to have someone come in to help domestically or have someone come in to help medically, what would be your number one recommendation?
I think it's getting the bathroom equipped and organized. usually if you fall, then that's a big thing. You'll usually the solution is that you end up in a long-term care facility. So it's a good idea to make those modifications in the home, and having somebody such as Bayshore Home Health come in to assist with that bath. So they don't have to be right there, but just outside the door, making sure that everything's
You'd be able to
okay.
have a look and say, this is the #1 priority in this home.
Correct.
Yeah.
How can people get in touch with you if they're interested in your help?
We have a website. It's bayshore.ca. We also we have our phone number is 613-226-7682.
Joan, thank you so much for visiting us.
Joan.
Really appreciate it.
Thank you for having me.
Great tips there.
Yeah,
I mean,
right.
just simple things as decluttering your home and throw rugs and things like that. Sounds simple to us sitting here, but often we don't think about it. Don't go away. TL and I will be right back right after this.
Thank you.